This screencast will focus on the following objectives: contrast neural divergence in the parasympathetic and sympathetic divisions, explain why the effects of the sympathetic division are more widespread and longer lasting compared to the parasympathetic division. Recall that the parasympathetic division has long preganglionic fibers, shown here in the dark purple, and short postganglionic fibers, shown here in the lighter purple. Those preganglionic fibers stretch almost all the way to the effector organs. Let's contrast that with the sympathetic division shown on the right. The preganglionic fibers are relatively short, shown in dark green, and the postganglionic fibers are comparatively long, shown in the light green. Because the sympathetic nervous system has relatively short preganglionic fibers, it exhibits more neural divergence compared with the parasympathetic division. Neural divergence simply means that a preganglionic neuron synapses with more than one postganglionic neuron. If you look at this image, you can see we have one preganglionic axon that is synapsing with, in this example, 3 postganglionic axons, and then each of those postganglionic axons extends to a different effector organ. Because this is an example of neural divergence. Because the preganglionic axons are shorter in the sympathetic versus the parasympathetic division, there's more neural divergence in the sympathetic division relative to the parasympathetic division. Remember that the parasympathetic preganglionic axons extend all the way, or almost all the way, to the effector organs. Well, what does this mean? Well, this means that the activity of the sympathetic division is much more widespread compared to the parasympathetic division. Because of neural divergence, several effector organs are affected by the activity of one preganglionic neuron. In the parasympathetic division, since the preganglionic axons extend almost all the way, and in some cases all the way, to the effector organs, the activity of the parasympathetic division is less widespread and more limited compared to the sympathetic. To provide you with some numbers, one anatomy and physiology book that I read says that for each preganglionic neuron, you have 10 to 20 postganglionic neurons with which it synapses. In the sympathetic. In the parasympathetic, you have 5 or fewer postganglionic neurons synapsing with a preganglionic neuron. So there is much more neural divergence in the sympathetic division versus the parasympathetic division, and that's one reason why the effects of the sympathetic division are more widespread compared with the parasympathetic division. Another is the fact that if we go back to this image, see the preganglionic neurons located in the lateral horns of the spinal cord. Those preganglionic fibers extend, shown in green, extend into the sympathetic chain ganglion. Some of them synapse with postganglionic neurons at the same level of the spinal cord, at position number 1. Others, however, ascend to synapse with postganglionic neurons, as shown at number 2. Others descend and synapse with postganglionic neurons at lower regions of the body, and then still others pass completely through and synapse at collateral ganglion. This is another reason why, because of the significant branching of these preganglionic axons. This is another reason why the effects of the sympathetic division are more widespread compared to the parasympathetic division, where the effects are more limited. Another reason why the sympathetic division has more widespread effects compared to the parasympathetic division is because of hormones released by the adrenal medulla in response to sympathetic nervous system activity. Preganglionic axons synapse with neurons, or like a modified neuron, in the adrenal medulla, and in response they release hormones. Those hormones, norepinephrine, circulate throughout the body in blood, binding to any receptors or any cells that they come in contact with. And so for that reason, that's another reason why the effects of the sympathetic nervous system are more widespread compared to the parasympathetic. And also, the effects of the sympathetic nervous system are more prolonged compared to that of the parasympathetic nervous system. And that's because hormones circulate for a much longer period of time than neurotransmitters do at a synapse. So not only do we find the effects of the sympathetic nervous system more widespread, but they are also more prolonged compared to parasympathetic nervous system effects. So in summary, the sympathetic division has effects that are more widespread or diffuse compared to the effects of the parasympathetic nervous system. This is because of greater neural divergence and effects of the adrenal medulla. The parasympathetic nervous system, because it has relatively long preganglionic fibers that extend almost, if not all the way to the effector organs, it is much more selective about which organ or organs it targets. Our next objectives are as follows. Explain how the sympathetic and parasympathetic divisions can have contrasting effects on the same organs. Explain how a neurotransmitter can have different effects on different target cells. Describe the two types of cholinergic receptors and identify the cells on which they are found. And lastly, describe the two types of adrenergic receptors and identify the cells on which they are found. As stated earlier, typically these two subsystems of the autonomic nervous system have contrasting effects on the same organ. For example, if we look at the heart, the sympathetic division increases heart rate, the parasympathetic division decreases heart rate. So the two subsystems can have different effects on an organ, like the heart. Also, a single subsystem can have different effects on different organs or tissues of the same organ. For example, what we're looking at here is the urinary bladder. The parasympathetic nervous system causes smooth muscles in the walls of the bladder to contract, as shown where I have the red arrow pointing to the plus sign. That's the wall of the bladder. The parasympathetic nervous system causes the walls of the bladder to contract. That's what you feel when you get the urge to go. At the same time, the parasympathetic nervous system causes smooth muscles of the internal urethral sphincter, the opening to the urethra, to actually relax. That's where I have the red arrow pointing to the negative sign, indicating that it's inhibiting contraction of smooth muscle at that location. So here we have the parasympathetic nervous system having two different effects on the same type of tissue, in this case, smooth muscles. So this begs the question, how can two subsystems have different effects on the same organ? Going back to the heart, we of course know that the parasympathetic nervous system slows the heart down, the sympathetic nervous system speeds it up. How is that possible? Well, it's because the two subsystems secrete different neurotransmitters. The sympathetic nervous system secretes noradrenaline that causes cardiac muscle cells to contract faster and also to contract harder. Acetylcholine, released by the parasympathetic division, causes cardiac muscle cells to relax, and therefore the cardiac muscle cells don't beat as hard and they don't beat as quickly. And what about how one subsystem can have different effects on different tissues? Going back to the bladder, how can we have smooth muscle in the wall of the bladder being stimulated by the parasympathetic nervous system, and yet the same type of tissue, smooth muscle at the internal urethral sphincter, relaxing in response to parasympathetic activity? The answer is cells can have different receptors for a new neurotransmitter and therefore respond differently to the same neurotransmitter. So receptors on the cells of smooth muscles in the wall of the bladder have a different receptor for acetylcholine compared to the smooth muscle cells of the internal urethral sphincter. So even though the same neurotransmitter is binding to these receptors cause different responses in the smooth muscle cells at these two different locations. So ultimately, neurotransmitters and the receptors that they bind determine the effects of the two divisions on cells, tissues, organs. So let's now discuss the neurotransmitters and the receptors of the autonomic nervous system. Recall that all autonomic nerve fibers secrete either acetylcholine or norepinephrine. So all autonomic nerve fibers are either cholinergic or adrenergic. And for each of these neurotransmitters, there are two major classes of receptors. There are two major classes of cholinergic receptors and two major classes of adrenergic receptors. Let's look first at the parasympathetic division. Acetylcholine is secreted by both preganglionic fibers and postganglionic fibers of the parasympathetic division. So, in other words, all parasympathetic nerve fibers are cholinergic. And any cell, tissue, or organ that responds to the parasympathetic nervous system therefore has to have cholinergic receptors. Those are receptors that bind acetylcholine. So looking at this figure, in order for the parasympathetic division to affect cardiac muscle cells, those cardiac muscle cells have to have cholinergic receptors. Likewise, that postganglionic neuron there that's responding to acetylcholine from the preganglionic fiber, that also has to have cholinergic receptors. Again, receptors that bind acetylcholine. There are two major classes of cholinergic receptors, that is, receptors that bind to acetylcholine. I want you to know their names, I want you to know where they are found, and I want you to know whether or not they are stimulatory or inhibitory. Stimulatory means that when acetylcholine binds a receptor, it causes excitatory postsynaptic potentials in the receiving cell, making it more likely that that receiving cell will generate an action potential. Inhibitory means that when the receptor binds acetylcholine, the receiving cell generates an inhibitory postsynaptic potential, making it less likely that that receiving cell will generate an action potential. The first class of receptors are the nicotinic receptors. Nicotinic receptors are so named because the drug nicotine will bind to them. All postganglionic neurons of both the parasympathetic division, shown in this figure, but also the sympathetic division, have nicotinic receptors. The adrenal medulla, although technically part of the sympathetic division, also has nicotinic receptors. In terms of target cells with nicotinic receptors, any target cell or organ that responds to the parasympathetic nervous system has nicotinic receptors. For example, the heart responds to the parasympathetic division. Therefore, it has nicotinic receptors to bind acetylcholine released by the parasympathetic division. Because remember, the parasympathetic division only really produces acetylcholine. So to summarize, all cholinergic receptors of postganglionic neurons are nicotinic receptors. Nicotinic receptors are always excitatory because they open ligand-gated ion channels, as we saw when we were looking at how motor neurons stimulate skeletal muscle fibers to contract. There are two major classes of cholinergic receptors. I want you to know the two classes by name. I want you to know where they are found, and I also want you to know if they are inhibitory or stimulatory. To be stimulatory means that when acetylcholine binds the receptors, it causes an excitatory postsynaptic potential in the target cell. That makes the cell more likely to generate an action potential. Inhibitory means that when acetylcholine binds to the receptor, it causes an inhibitory postsynaptic potential, making it less likely that an action potential will be generated in the receiving cell. Nicotinic receptors are so named because they bind to the drug nicotine. These cholinergic receptors are found in the adrenal medulla, and all postganglionic cells of the terminal ganglia of the parasympathetic division. So all of the preganglionic fibers release acetylcholine. All postganglionic neurons therefore have nicotinic receptors, allowing them to respond to that acetylcholine. Recall that the adrenal medulla, the cells in the adrenal medulla, are really modified postganglionic neurons. And they respond to nicotine because, they respond to acetylcholine because they have nicotinic receptors that bind that acetylcholine. Nicotinic receptors are always excitatory. That's because those receptors are attached to sodium channels that open, allowing sodium to move into the cell and then cause a depolarization that could lead to an action potential. By the way, when we were discussing how neurotransmitters, acetylcholine, from motor neurons in the somatic nervous system caused excitatory postsynaptic potentials or end-plate potentials to occur in skeletal muscle cells, those receptors were nicotinic receptors. So all of our skeletal muscles also have nicotinic receptors, even though that's the somatic division. There are two major classes of cholinergic receptors. I want you to know the two classes by name. I want you to know where they are found, And I also want you to know if they are inhibitory or stimulatory. To be stimulatory means that when acetylcholine binds the receptors, it causes an excitatory postsynaptic potential in the target cell. That makes the cell more likely to generate an action potential. Inhibitory means that when acetylcholine binds to the receptor, it causes an inhibitory postsynaptic potential, making it less likely that an action potential will be generated in the receiving cell. Nicotinic receptors are so named because they bind to the drug nicotine. These cholinergic receptors are found in the adrenal medulla, and all postganglionic cells of the terminal ganglia of the parasympathetic division. So all of the preganglionic fibers release acetylcholine. All postganglionic neurons therefore have nicotinic receptors, allowing them to respond to that acetylcholine. Recall that the adrenal medulla, the cells in the adrenal medulla, are really modified postganglionic neurons. And they respond to nicotine they respond to acetylcholine because they have nicotinic receptors that bind that acetylcholine. Nicotinic receptors are always excitatory. That's because those receptors are attached to sodium channels that open, allowing sodium to move into the cell and then cause a depolarization that could lead to an action potential. By the way, when we were discussing how neurotransmitters, acetylcholine, from motor neurons in the somatic nervous system caused excitatory postsynaptic potentials or end-plate potentials to occur in skeletal muscle cells, those receptors were nicotinic receptors. So all of our skeletal muscles also have nicotinic receptors, even though that's the somatic division. Muscarinic receptors are found on cardiac and smooth muscles, as well as any gland that responds to acetylcholine. So the muscarinic receptors are found on any autonomic effector organ that responds to acetylcholine. So any smooth muscle that responds to acetylcholine, it contains muscarinic receptors. Any gland or any cardiac muscle that responds to acetylcholine, it contains muscarinic receptors. The receptors are so named because there is a toxin produced by mushrooms that will bind to the receptor. Sometimes muscarinic receptors are excitatory, sometimes they are inhibitory. Typically, smooth muscles of the small intestine have excitatory muscarinic receptors. That's why acetylcholine from the parasympathetic nervous system causes an increase in intestinal motility. Whereas in cardiac muscle cells, they are inhibitory. And that's why acetylcholine causes the heart to slow down and not to beat as hard. The muscarinic receptors turn on a variety of second messenger systems. That's how the muscarinic receptors work. They work through second messengers. So acetylcholine binds the muscarinic receptors and it turns on second messengers inside the target cells. So what about the sympathetic division? We focused on the parasympathetic subsystem. I did mention that the adrenal medulla contain cholinergic fibers, but that's the only time I talked about the sympathetic division. Well, again, if we're talking about postganglionic neurons, all postganglionic neurons in the autonomic nervous system are contain nicotinic receptors, regardless of whether you're talking about the sympathetic division or the parasympathetic division. All postganglionic neurons contain nicotinic receptors because they all respond to acetylcholine. They all have nicotinic receptors. However, in the sympathetic division, very few postganglionic fibers release acetylcholine. There are a few, but they are a chosen few. For the most part, the only postganglionic neurons or fibers that release acetylcholine release them onto eccrine sweat glands. And there you have muscarinic receptors. But again, there are very few sympathetic cholinergic fibers. Most postganglionic fibers of the sympathetic division are adrenergic. That is, they release norepinephrine as the neurotransmitters. Therefore, any target cell of the sympathetic division must have adrenergic receptors in order to respond to norepinephrine. So now let's look at the two subclasses of adrenergic receptors. So there are two major categories of adrenergic receptors. There is alpha and there is beta. Alpha adrenergic receptors are usually excitatory. That is, when they bind noradrenaline, they will cause an excitatory postsynaptic potential, which increases the chances of that target cell generating an action potential. So when noradrenaline binds to these receptors in smooth muscles, they can stimulate the smooth muscles to contract, such as in blood vessels or in the uterus. However, they're not always excitatory. Sometimes they're excitatory. Usually they're excitatory, but not always. They can also, in other locations, these adrenergic receptors are inhibitory. They can inhibit smooth muscle contraction involved in intestinal motility, for example. And it gets complicated because you have subclasses of alpha adrenergic receptors. You have what are called alpha 1, alpha 2. They're in different locations of the body. And they can respond slightly differently to noradrenaline. Okay, you are not responsible for knowing the two subclasses. You may encounter them when you take a pharmacology course or somewhere in your nursing program. I simply are stating that they exist so you are aware. Okay, but you do not have to know the two subclasses. The other category of adrenergic receptors are the beta adrenergic receptors. They usually have inhibitory effects. And I say usually because it's not always. They usually have inhibitory effects such as on smooth muscles of the bronchial tubes. It causes them to dilate and therefore enhance airflow. Someone who is having an asthma attack, or they may be having problems breathing, they may be prescribed an inhaler where they inhale albuterol, which is basically a adrenergic receptor agonist. It acts like adrenaline, binding to these adrenergic receptors. It causes the smooth muscles in the bronchial tubes to relax, and that causes dilation of the bronchial tubes. Now, I said that beta adrenergic receptors usually have inhibitory effects, right? So that would cause the smooth muscles to relax in the case of the bronchial tubes. But that's not always the case. On cardiac muscle, they're actually excitatory. If you've ever heard of a beta blocker, that typically is prescribed someone who has a accelerated heart rate, sometimes people who have anxiety. And basically what a beta blocker does is it binds to adrenergic receptors and it prevents the endogenous adrenaline or noradrenaline from binding. Okay? There are two subclasses, well actually there's three subclasses. In the previous book they introduced two. Your current book they introduced three: a beta 1, a beta 2, a beta 3. Now again, I'm not holding you responsible for knowing that. I'm simply presenting you with that information in case you may run into those subclasses at some point in the future. Now, receptors. Why do you care about muscarinic and nicotinic and alpha 1 and beta 1 receptors? Why do you care? Well, many drugs work through binding these receptors. Okay, many of them selectively bind to one class or another. For example, atropine, which is responsible for dilating pupils. I don't think they use that anymore, but they used to, binds to muscarinic receptors. That's what causes the pupils to dilate. Curare, at one time, was a muscle relaxer. It binds to nicotinic receptors, and it basically blocks the acetylcholine from binding to those receptors and causing your skeletal muscles to contract. Now, curare, there's a very small window between effective dose and paralyzing dose, and a little too much of it can cause skeletal muscles like your diaphragm to relax. And if that happens, you go into respiratory arrest. And so curare is not used medicinally anymore, to my knowledge, but it is a very effective muscle relaxer. Propranolol is a beta blocker. It's used to treat angina, hypertension, and also to prevent heart attack. And another one, Cartera, is an alpha blocker, also used to treat hypertension and also improve urination in men. It basically causes relaxation of smooth muscle. So there are many drugs that work through these receptors, either blocking them so that noradrenaline or nicotine can't bind the receptors and cause effects in the target cells, or they bind the receptors and act like those neurotransmitters and cause effects in those cells themselves. This table in your book lists several classes of drugs, the receptors that they bind, and their effects. Okay. So maybe read over this table. I certainly am not going to ask you any information found on this table, but it drives the point home about the importance of these receptors. And when you take a pharmacology class and you start to learn about commonly used drugs and how they work, many of them are going to bind these receptors, and that's how they're going to exert their medicinal effects. Okay, so that's why it's important that you familiarize yourself with these receptors. So I think it's pretty clear how the autonomic nervous system changes, or how it affects the contraction of cardiac muscle and smooth muscle. But how does it affect glands? Well, for the most part, glandular secretion increases or decreases as blood flow through that gland increases and decreases respectively. So because glandular cells form their secretions from the blood. So increase in blood flow to the glands, increase in the secretion from those glands. So typically the autonomic nervous system increases and decreases the activity or the secretion of a gland by increasing and decreasing blood flow to that gland. So an increase in blood flow to a gland results in an increase in secretion by that gland. A decrease in blood flow to a gland results in a decrease in secretion by that gland. Now, earlier we talked about how the sympathetic effects persisted longer than the parasympathetic effects. And in our earlier discussion, we focused on the effects of the adrenal medulla, but there's also another reason. Acetylcholine, which is produced by parasympathetic nervous system is broken down relatively quickly by a enzyme called acetylcholinesterase. So after acetylcholine binds its receptors for milliseconds and then detaches, acetylcholinesterase breaks it down pretty quickly. Noradrenaline, its destruction is a little more complicated. Some of it can be taken back up by the synaptic knobs that secreted it in the first place, so it can be reused. Typically what happens is the enzyme monoamine oxidase breaks it down, or MAO. You may be familiar with MAO inhibitors as antidepressants. MAO inhibitors inhibit this enzyme, and therefore noradrenaline persists in the synaptic cleft a little longer. Some noradrenaline, however, escapes from the synaptic cleft where it diffuses to adjacent tissues, where it can bind receptors prior to being broken down. But a significant amount actually escapes the synaptic cleft altogether and enters the bloodstream, and there it can have, again, prolonged and rather widespread effects. So here is yet another reason why effects of the sympathetic nervous system tend to persist longer than the parasympathetic system. Now, I am not going to hold you responsible for knowing all these enzymes, okay? In general, I want you to realize that noradrenaline isn't broken down as quickly as acetylcholine for all the reasons stated here, but you don't have to know them specifically. And that's one of the reasons why sympathetic effects persist longer than parasympathetic effects. And of course, things are never as simple as I present them, because acetylcholine and norepinephrine are not the only neurotransmitters released by the autonomic nervous system. Do understand that there are neuropeptides, there are enkephalins, substance P, many other neurotransmitters or substances that can modulate the activity of neurotransmitters that are released by fibers of the autonomic nervous system as well. I am not holding you responsible for knowing any of their names, but I just want you to be aware that acetylcholine and norepinephrine are not the only neurotransmitters or substances like neurotransmitters that are released by the autonomic nervous system.